Royal Doc, Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. And today's topic is all about shoulder dystocia. What is shoulder dystocia?
Well, it is actually, in a nutshell, the difference in the mom's pelvis is too small or baby's too big, and it actually has to do with shape as well. For example, babies with broad shoulders or big chests have a little more trouble.
Is shoulder dystocia an emergency?
Absolutely. It's one of the probably 3 or 4 emergencies in obstetrics. And the thing about it is the reason it's an emergency are there two. You can't predict it. That's one problem. The other problem is you have about 2 minutes to identify it and to fix it.
What is the greatest risk to the baby in a shoulder dystocia delivery?
Oxygen deprivation. You know, they don't always have, the cord isn't always collapsed, but it certainly can be. And then, of course, there's nerve injury, which is the main problem there is brachial plexus, which is here. And if you stretch that too much, trying to pull the baby out, then you can have paralysis of the shoulder, the elbow, and the hand. So that's a serious problem. Fractures can occur, clavicle, humerus fractures can occur. Clavicle fractures are really not a big problem. They heal by themselves.
What are the risks for the mother involved with shoulder dystocia?
Well, they are vaginal and vulvar tears mostly. A big episiotomy is another problem. And then, of course, there is the psychological or emotional problem because these things can be quite terrifying.
How often does shoulder dystocia occur?
Not very often, thank goodness. Anywhere between 0.2% and 3%. And of course, if you are diabetic, that really increases your risk. You're more likely to be in that 3% area if you're diabetic.
Which babies are most likely to be affected by shoulder dystocia?
Large babies are the biggest problem. Again, shoulder dystocia is a function between the discrepancy in the size of the pelvis. In other words, not big enough, and the baby that's too big and the wrong shape. And the biggest problem is for babies who are from diabetic moms. And the problem is their shoulders and their chest.
Which mothers are greatest risk for having a baby with shoulder dystocia?
The greatest risk would be maternal diabetes. And of course, there are 3 kinds of diabetes. You have the childhood onset, you have the adult onset, and then you have the pregnancy onset. But it's really the adult onset that would be the biggest problem.
What other factors are associated with shoulder dystocia?
Well, assisted delivery, for example, forceps, vacuum extractors, prolonged labor, difficult descent, that is a hard time getting the head to crown.
What is the first step in managing shoulder dystocia?
Well, the first thing you need to do is recognize that you have an emergency. And you know, the way you do that, and this isn't talked about very much on the internet, even AI isn't going to come up with it, but it's called the turtle sign. So the head comes out and then it gets back in again part way. So that's something we really hate to see, but it is a very good sign. It's the first sign.
What's the most important step in managing shoulder dystocia?
Well, of course, after you recognize it, then you have to make the goal of managing shoulder dystocia is to make the pelvis bigger and to make the baby smaller. So the way you make the pelvis bigger, it's called the McRoberts maneuver, and it's where you put mom's knees up here. And what that does is it opens the pelvis and it makes room in the back. It also gets her back off the bed. So, and as far as managing the baby, the best way to make the baby smaller is to deliver an arm. You reach for a hand, you pull it out. And sometimes, I mean, that does work almost always. If you can find the hand, and you almost always can.
What is the next action priority after the McRoberts maneuver?
That would be pull the hand out.
Why is it important to deliver the baby's arm?
That really decreases the diameter of the shoulders, so it makes the baby smaller from that point of view. I had, years ago in my residency, I had a young woman from Thailand. She's in Mount Mung. She's about 4 feet 10 inches tall, and she had a 10-pound baby. Delivered with forceps, but I had to I pulled out the back arm, and I still couldn't get the baby out. So I had to turn the baby around, which is a legitimate procedure, and deliver the other arm. So they were like this, and then I got the baby out. So all's well that ends well, Neil.
How do you prevent shoulder dystocia?
Well, the best way is to make sure that mom has a reasonable weight gain and make sure that her blood sugar is reasonably controlled.
All right. The best place to go is ruraldocallen.com and pick up Pregnancy Your Way, available in Amazon. Thanks, Doc.
Thanks, Neil.
All right. That was a Rural Doc Allen podcast, guys.